Welcome back. This morning we've got a special Consumer Confidential on the coronavirus. Now, there are more than 100 cases in more than a dozen states being reported. We're going to try to help you prepare your home, your family, and answer some of the biggest questions you've got. We're going to start with NBC News investigative and consumer correspondent Vicky Nguyen. Vicky, thanks so much for helping us. So let's get started talking about our family, okay? Getting our families ready. What supplies should we have at home?
This is so important. We're following the guidelines set out by the Department of Homeland Security. And the idea really here is to have 2 weeks supply of everything that you need. And that really includes food and water. Some people have been asking us on social media, well, are we concerned that the water supply is going to be contaminated? Why do we need bottled water? No, the idea is if you have to self-quarantine, or perhaps you rely on bottled water to make things like formula, 2 week supply is good. That's a good rule of thumb for any sort of emergency, especially this pandemic. The other thing, if you've got babies, formula, diapers, those kinds of supplies for a month, and also think about, think about soap, detergent, household goods that you may need. It's so that if you are stuck in your home for some time, or if there is a supply chain breakdown, you have what you need and you don't have to go out.
Okay, and then we're talking about if all of a sudden we've seen a couple of schools around the country closing down. How are schools prepared? How do you talk to the educators that run your kids' school about what they're going to do and what their plans are?
This is so important, Al. Don't hesitate to ask questions. Call the school principal, the superintendent, and say, what are we going to do? Do we have a plan in place? Are you preparing laptops or iPads with lessons that can be sent home with students? Let's say the school has to shut down just for a couple of days for a cleaning, perhaps. Maybe it's not prolonged. What are we going to do about that? And also prepare for the domino effect. If you work outside the home, can you telecommute? Can you use video conferencing? Have that conversation with your direct manager or your HR department.
All right, Vicky, thank you so much. Maria?
Okay, here with Dr. Nat, we're going to talk medical. This is a big thing that's got people worried about how should I handle my prescriptions? I need them day to day. How far out should I get them?
Right, Maria. So picking up on what Vicky said, I think everybody needs to keep in mind they need to anticipate a sudden 14-day quarantine where they may not be able to leave the house. So I'm going to say at least a 2-week supply of your medicine. If you can go ahead and call, get a 30-day supply. We all know insurance companies don't necessarily cover 90-day supplies, but I think at a minimum you want to have that expectation. If I, from one day to the next, need to stay home, do I have all my medicines for at least 14 days?
Okay, and that includes animals' medicines as well.
Absolutely.
Okay, so what if people are feeling a little bit under the weather and they want to get a test? Is that covered by insurance? That was a big question for a lot of people.
So two things here. We have availability and we have cost. It's not a limitless capacity of testing right now. For example, at our institution in New York, we have the state lab, we have public health labs, and we have CDC. Offices and hospitals don't necessarily have in-lab diagnostics up and running at the moment. So if you are concerned about whether or not you are feeling sick, and that kind of gets into number 3, you have to think about the idea of, are you going to stay home? Are you going to go to the doctor's office to get tested? There is no such thing right now as if you're mildly symptomatic. There is no recommendation to go physically to your doctor's office or the ED. We don't want to flood those places. We would want to actually call ahead to your doctor, use virtual care, and they can triage you sort of remotely and let you know and give guidance as to where to go.
Okay, so people will say, like, I don't know, maybe I have the flu, maybe I have the coronavirus. How do you tell the difference?
So the big thing here is if you have mild respiratory symptoms, you can safely call your doctor, stay home, and get better. Fever and cough, if you go out into a medical facility, you are going to get masked right away. Anybody certainly with shortness of breath, chest pain, high fever, call ahead so the emergency room knows that you're coming.
Virtual care. Over to you, Craig.
All right, Maria, thank you. Thank you, Dr. Natalie. Let's turn now to NBC News correspondent Tom Costello. Covers travel, aviation, has also become a bit of a coronavirus expert here over the last few days. Let's talk about travel here, Tom. Let's say you have to cancel a trip. What's the best way to do that?
Well, the good news is all the airlines right now are waiving change fees. JetBlue, American, as well as Alaska, and one more here. American, I think I said American, JetBlue, Alaska. They're all waiving domestic change fees. I think United is too. Delta's doing so on international flights. So the bottom line is, if you're traveling through the end of March, you should have your change fees really for free. You should have your ability to change your ticket for free. Beyond March, then that becomes something we have to see what happens down the road. If you're not comfortable with traveling because of coronavirus, you should be able to get your money back.
You should be able to. If you can't, how do you fight for that refund or credit?
Well, So the airlines will apply that credit to your account, and you can use that, the full amount of that credit, over the next 12 months or so. We should, by the way, make the mention that the flight attendants unions are now calling for more proactive steps to protect them and passengers in the air. For example, they want to see more face masks. They want to see more hand sanitizer. They want to try to allow for more disposable cups instead of glasses.
Yeah.
They're doing everything they can as well to protect themselves.
Tom, really quickly here, if you've got to book some new travel here in the coming months, should you get travel insurance?
You know, I hear from a lot of people who think it's a good idea. Now, if you buy travel insurance, you will get 50 to 75% of your ticket back in most cases. So it may be something you want to consider doing. You might want to also consider, just as a normal precaution, buying medical insurance or medevac insurance. I've had friends who have bought it, and sure enough, they had a medical emergency and they had to be airlifted back home, and they were very grateful that they bought that protection. So it's something to consider, and you can go to a number of websites to figure out whether this makes sense for you.
Tom Costello for us in Washington. Tom, thank you. Dr. Natalie Azar, thank you. Vicky Nguyen, thank you as well. And we've got much more information online, as well as updates as they come in. This coronavirus crisis is a fast-moving story. Today.com/health for all you need to know.